My name's Dr. Manrina Rhode. I'm a facio-aesthetic dental surgeon in central London. Before we went back into practice, we all came in and we did a trial run of the new procedures that we had in place so that when we actually came back in, it wouldn't be quite so daunting. So what we decided was that the staff would all enter through the back entrance. So we would call reception and then we'd enter through there when we arrived. And then as we arrived, we'd go into a changing area and there would be a separate plastic box where we'd take off everything that we'd worn from the outside environment, put that in a box, put on our uniform, and then come into clinic. And then in clinic, the way that we've been working is we've been working one dentist at a time rather than all working on the same days, and we've separated out the surgeries. So we've got an aerosol generating surgery, we've got a surgery that we use for donning and doffing, our PPE, and we've got a surgery that we use for non-aerosol generated procedures. From the patient side, when they come in, they're given a mask. So our patients all wear masks through the whole reception area until they come into surgery, even while they're talking to us, until we actually start work. And if we're doing an aerosol generating procedure, the patient's also covered over, so they're also gown up and made to wear a gown. We take their phone from them as well, so that's not spreading. I'll put it in a little cellophane bag, so that's not spreading virus. We get them to rinse with peroxide mouth rinse for a minute before we actually work inside the mouth, and we have virus killer. We bought a virus killer filter, which we've got in each of the surgeries, which actually clears out the air within 20 minutes between aerosol generated patients. As well as all the extra PPE that we've got on. We had our fit tests, so we've got really good close fitting masks. We double mask and then visor, and then I've covered my hair's covered, and then my uniform's all covered as well for aerosol generating procedures. I haven't seen a drop in numbers coming back. To be fair, we've only been open a week. There's a big waiting list of patients that want to be seen. Those that were cancelled before lockdown, those that contacted us during lockdown because they wanted to start treatments, and obviously the emergencies that came about in lockdown as well. And because it's a slower process, so because we're not all working at the same time, so we're not at maximum capacity at the moment, and also we're leaving these gaps between patients. We were leaving an hour's gap, and then before the special virus killer filters arrived, and now we're leaving 20 minutes between aerosol generating patients. And also, you don't always know whether you're going to generate aerosols. You want to allow that extra time, so we're pretty busy, we're pretty booked up, to be honest, with the backlog. And also I think patients are building up confidence in dental practices. They're probably realizing it's one of the safest places to be with regards to spread of COVID, because there's so many precautions in place to make sure that doesn't happen. I guess my advice to practices is don't worry. I know it's all really intimidating, going through all the documents that are coming and trying to work out what the right thing is to do and what you should be doing, what you shouldn't be doing. But just go through, start working, get your PPE in when you feel comfortable, go back to work, and once you're actually there and you're doing it, it's not so bad. I say it's not so bad. It gets pretty difficult to breathe under that mask, and it gets quite hot with all the PPE on, but other than that, it's not so bad.